Hello all, and welcome back to my channel. If you are new here, hello, welcome. My name is Lanice, and if you're not new here, thank you again for tuning into another one of my videos. It is greatly appreciated. If you are not a subscriber here, I ask that you please hit the subscriber button. I am at like 885. My goal is to get to 1,000 subscribers by the end of the year, and so I just ask that you please help me hit that goal. And if you don't know who I am, if you've never been here before, my name is Lanice. I am a registered nurse. I'm licensed in the state of North Carolina, but I'm currently travel nursing, so I am on contract in Texas. If you are not new here, then you see that I am at my own apartment in Charlotte, North Carolina. However, I'm just here for the week. I'm still on contract, and I'll probably extend my contract past November and probably extend it till February if everything goes as planned. So, sorry, got a notification. So, I am here today because I have been working as a med-surg nurse for the last year and almost a year and a half now. And I feel like I want to come and tell you guys some of the pros and cons of working on med-surg. As a new grad nurse and as a nursing student, you will hear a lot of people say, go work on med-surg for a year and then you'll be able to branch out and become whatever kind of nurse you would like to be. And that has been the story for a lot of nurses. It kind of is my story. I have not branched out and moved on to any different type of nursing. I decided to actually go the travel route after I did my year on med-surg, so I'm still working in med-surg, but that is kind of the story that they tell you while you're in nursing school and you're applying for jobs, whatever, whatnot. And even though that is the story for most nurses and it is what people will tell you, I am here to say that if you do not want to go into med-surg as soon as you get out of nursing school, you don't have to. There are a lot of nurses who go straight to the ICU, to the ED, wherever they want to go, they go, and they will take you anywhere you want to be. I'm trying to tell you, it's so short. Everywhere you go, they want nurses. Wherever you are, whatever level you're at. I know nurses who were off the floor for several years, but when this pandemic started, they got back at the bedside. So you can go wherever you want to go. That's what I'm trying to say. But I have been working on med-surg since I started my acute care experience, and so I'm just here to tell you guys a few pros and a few cons of being a med-surg nurse. So, a few of the pros that I would have to say come with being a med-surg nurse is you really learn prioritization. And you learn prioritization because majority of the time you're going to have at least 5. Some floors take 5 patients. Now, the nurse to patient ratios on the floors that I've worked on are 5 and 6. I very rarely ever only get 4, and I'm never taking more than 6. And I'm at the floors that I work on, I refuse to take more than 6. I will not do it. But I've never been asked either, to be honest with you. So being that you do have 5 patients, you have no choice but to learn good prioritization, because for one, you're always going to have that patient that does not mind giving you a headache, and they will call you into the room for this and for that, and you will be in that room all day talking to them and trying to tend to their needs if you allow them to take up all your time. You're always going to have that one patient, it seems like. But then you're also going to have the patient that actually really needs you, that really is sick and probably isn't making any noise and isn't asking you for anything. So you as a nurse, you learn how to prioritize your day, prioritize your patient's diagnosis and what they need. You have no choice but to learn that. Another pro with being a med-surg nurse is that you grow to learn how to give a good report to other nurses. And I feel like that is important because the more you give report and the more you interact with other nurses and the better you get at it, the more you build your confidence as a nurse. So I think that will be the next pro of being a med-surg nurse. I feel like that it has given me a lot of confidence in what I know, and in trusting what I know as a nurse has given me a lot of confidence in the fact that I am becoming a better critical thinker. I believe that that's probably one of the best things that has happened since I've been on med-surg, is that my confidence as a nurse has begun to soar. So another benefit of working in med-surg, now this depends on what type of med-surg floor you work on. I have worked on a pulmonary med-surg. I spent majority of my time this last year on a cardiac med-surg, and now that I've begun traveling, I work on just a general med-surg floor. Now working in pulmonary and working in cardiac, of course I saw more, if not all, pulmonary or cardiac diagnoses while I was working on those floors, because that was the reason that they were there. But now working in general med-surg, I see so many different diagnoses. Just about anything that you have read about in your nursing diagnosis book, I have seen that now working in general med-surg. And so I believe that it makes you a very good all-around type of nurse. Like, you get to see so much that you become very well-rounded as a nurse working on med-surg. And not only do you seeing those different kind of diagnoses and having to learn about those and, you know, what to look out for with those diagnoses, you also get to use majority of the skills that you've used or you learn in nursing school. You get to use majority of those skills while you're working in med-surg, from NG tubes to the floor I work on now. They have rectal tubes, different injections, all sorts of different kinds of medications. You get to see so much working on med-surg, whereas if you're in the ICU, you do see a lot, but those people are usually there for very specific reasons. So I feel like as a nurse, you become very well-rounded working in med-surg. I think another pro of working in med-surg is that majority of my patients get to make it out of the hospital. I can't speak for the ED or for the ICU, but working in med-surg, usually if people come to the hospital and they were admitted into the ICU and they make it down to the med-surg, that means they're getting better. Now don't get me wrong, I can get on my soapbox and talk about how hospitals are not there for preventative care, and how we're really just sending people home kind of sick. But they are getting better. So usually the people in med-surg, they usually go home after they're discharged. They're not discharged to their home with the big guy upstairs. Now, I know I spoke about how, you know, you get 5 patients and you have to learn prioritization, but I will say that having 5 patients makes the day go by very fast, especially if you're a day shift nurse. The day goes by super fast, and that has to be the pro, because it's like as soon as you start that first med pass in the morning, you usually don't really sit down until 3 o'clock in the afternoon to really start your charting. But by the time you start your charting, like, the day is about over. So the days go by so fast, and I think that's like one of the best parts of nursing in general. I never really had a job that really went by too slow, but in med-surg, I mean, it goes by super fast. But that leads me to the cons. It is super busy because you don't ever have enough staff. 5 patients may not sound like that much, but it is a lot. And 6 patients is even worse, and you very rarely ever have enough staff while you're working in nursing at all because of the nursing shortage, but you very rarely have enough staff on med-surg units. Another con that I would have to say comes with med-surg is the charting. The charting is way too in-depth for you to have 5 patients, especially being that you very rarely get to sit down and chart. The charting on med-surg can be very annoying, and it can be a nuisance at times, because if you don't chart it, it didn't happen. That's the #1 rule in nursing. Another thing is, in ICU, I very rarely see CNAs, but on the med-surg units that I've been working on, the CNAs have been very short-staffed also. So now in med-surg, I've caught myself having to take total care of my patients. Up to 5 patients, and maybe 2 or 3 of them are not able to do much for themselves, not get up and go to the bathroom. You know, bed alarms are always going off because people who don't need to get out of the bed are getting in the bed. Like, med-surg is very hectic, and now it's beginning to turn into total care because the acuity level that we're getting now is a lot higher, and the CNA ratio is getting a lot lower. So you as a nurse on med-surg, you may have days where you feel like you're working in the ICU because you're responsible for so much for your patients, and that itself can also be a headache. Now the med surg floors, people, like I said in the beginning of the video, they say, oh, go to med surg, get a year of experience and leave. And that's what a lot of nurses do. And since that's what a lot of nurses do, the nurse turnover is very high. You know, you find specialties like labor and delivery, the ED, the PACU, places like that. When nurses get jobs in those places, they very rarely ever leave, and that's why it's hard to find space in on those floors. But med surg, honey, people there today and gone tomorrow. I mean, it takes no time for a nurse to be in and out when it comes to med surg. The turnover rate is very high when it comes to med surg nursing. So right now, that's probably all the complaining that I can really think of I can do about med surg nursing. I wanted to keep this video very brief and get straight to the point, and I hope that this helped anybody out that's looking for a career in nursing, not really sure what kind of, you know, nurse they would like to be. If you wanted to know more about med surg, I hope that I helped you out. And if you guys have any questions, please. So my camera died. So as I was saying, I hope that this video helped you learn more about med surg nursing, especially if you're kind of questioning what type of nursing jobs to apply to if you're in nursing school, or if maybe, you know, you just want to try something new and you're interested in med surg just to see how it is, because nobody really wants to really be there. But if you have any questions, please leave the comments down below. I'm more than glad to answer any questions. I actually plan on doing a question and answer video soon, so all the questions that I get in my comments, I do plan on answering them one by one in one of the next videos. So feel free to leave some questions, any video ideas, anything. And I hope this video was helpful. And again, please like, share, and subscribe to my channel. My name is Lanice, and I'm out.